You thought labor was hard. Now you have the baby, and there are no instructions on what to do next. You need to interact with a baby that cannot talk and tell you what they need or want. Learning baby cues is helpful to decrease frustration. Babies have a very challenging journey to move from inside the uterus to the outside world. The beautiful thing about babies' heads are that they are very resilient and assume a normal shape, usually soon after their birth. Babies have soft spots called fontanelles that make it possible for their heads to mold and move out of the pelvis. This is a photo of that molding we previously discussed. Similarly, a baby can have areas of the head that present as a large soft area on the top of the head called caput. Looks very similar to this photo. This happens when there is prolonged pressure on the head as the baby moves through the birth canal. This quickly goes away within 1 to 2 days of birth. This is a photo of a cephalohematoma, which is caused by an area of the head that has constant pressure against it. This causes bleeding under the scalp and may last many months. It is seen with the use of a vacuum to assist baby's delivery and increases the risk of the baby's developing jaundice, or yellow skin, due to the need to reabsorb this blood. Soon after birth, some newborns may develop eye swelling and conjunctivitis, which is inflammation of the conjunctiva, the thin membrane covering the white part of the eye and the inner eyelids. This condition typically appears within the first few hours to days of life. One common cause is chemical irritation, often from antibiotic eye drops given at birth for infection prevention. In these cases, the swelling and redness are usually mild and resolve on their own. However, conjunctivitis can also be caused by infection, which is more serious. Bacterial causes, such as chlamydia or gonorrhea, and viral causes can lead to significant redness, discharge, eye swelling, and blindness if not treated properly. These forms require prompt medical evaluation and treatment to prevent more complications. Early recognition is important. By identifying the cause and providing appropriate care, most newborns recover fully without any long-term effects. Milia in newborns are tiny, harmless white or yellowish bumps, which are keratin-filled cysts on the skin, common at birth, appearing on the nose, cheeks, and forehead due to undeveloped pores or maternal hormones. They usually vanish within weeks to months without treatment, requiring gentle cleaning and no squeezing or harsh products. Babies have lots of marks on their bodies that come and go when crying or when hot or cold. Sometimes there are areas on the skin that may look green or like a bruise. This is called a Mongolian spot. It is more common in darker-skinned children, but can be seen in all babies. These are not bruises and will resolve over a few years. Stork bites are red areas between the eyes or on the nape of the neck. A hemangioma, is a collection of tiny blood vessels called capillaries that may increase in size for several years and then regress. Sometimes these are treated with laser therapy. After birth, it's common for newborns to show a few physical findings that can worry parents, but are usually normal and temporary. First, breast buds may be present in both male and female babies. This happens due to exposure to the mother's hormones before birth. The breast tissue may feel firm or slightly swollen and typically goes away on its own within a few weeks. Second, some baby boys are born with a hydrocele, which is a painless collection of fluid in the scrotum. It often looks like scrotal swelling, but does not cause discomfort. Most hydroceles resolve naturally within the first year of life. Finally, turned-in feet or mild inward positioning of the feet is common in newborns because of their position in the womb. In most cases, the feet can be gently moved into a normal position and will straighten out as the baby grows without treatment. Overall, these findings are common after birth and usually resolve with time and routine monitoring. The video, Happiest Baby on the Block, explains why newborns often cry and how parents can soothe them effectively. It introduces the idea of the fourth trimester, which suggests that babies are born before they are fully ready for the outside world and still crave the sensations of the womb. The video teaches the 5 S's technique to calm babies: swaddling to provide security, side or stomach positioning for soothing, shushing sounds to mimic the womb, swinging or gentle motion, and sucking, such as on a pacifier or a finger. When used together, these methods activate a baby's natural calming reflex. The main message is that crying is normal, and with the right soothing techniques, caregivers can help babies feel safe, calm, and comforted. Breastfeeding offers babies superior nutrition, immune protection from ear infections, ear, respiratory, and diarrhea infections, and lower risks for chronic issues like asthma, obesity, and SIDS. It also aids in postpartum recovery, uterus shrinking, and weight loss, reduces risks for certain types of cancers like breast or ovarian cancer, and type 2 diabetes. It fosters bonding and saves money and time. Breast milk provides antibodies and changes to meet the baby's needs, while skin-to-skin contact enhances connection and releases calming hormones like oxytocin. Formula feeding offers moms flexibility, dietary freedom, no food or drink restrictions, and shared parental bonding, while providing babies with consistent, measurable nutrition and a healthy alternative for medical reasons, ensuring all essential nutrients for growth. Sleep will comprise of most of the day, approximately 6 to 22 hours. Infants have 5 deep sleep states: deep sleep, light sleep, drowsiness, quiet alert, active alert, and crying. The average birth weight is 7 to 7.5 pounds. The average length is 20 inches. During the first 6 months of life, the infant will gain approximately 1 ounce per day, and their height will increase approximately 1 inch per month. Most healthy infants will double their birth weight by 3 to 4 months and triple it by 1 year. Here's what to expect at newborn and well-child checks. At each visit, measurements are taken, including weight, length, and head circumference, along with vital signs such as heart rate and respiratory rate. Growth and development are also monitored using handouts called Ages and Stages, which help track developmental milestones. There is time for immunization, discussion, questions, and education. At the 12 to 18-month visit, blood tests may be done to check for anemia and lead levels. Recommended vaccines include Hep B, rotavirus, DTaP, which covers diphtheria, tetanus, and acellular pertussis. Hib, which is pneumococcal PCV, and inactivated poliovirus, typically given at 2, 4, and 6 months. The influenza vaccine is recommended starting at 6 months and given annually. MMR and varicella are given at 12 months and again at 4 to 6 years. Hep A is given between 12 and 18 months. Later vaccines include meningococcal, Tdap, and HPV, which are recommended at 11 to 12 years of age. Babies are used to living in a very noisy environment, constantly being rocked. After they are born, it is quiet, and there's no constant connection to their birth parent. You cannot spoil a baby in the first 3 months of life. Children grow emotionally as well as physically, and they move through different stages as they grow. In infancy, babies learn trust when their needs are met with consistent loving care. During toddlerhood, children begin developing independence, learning they can try things on their own, with support. In the preschool years, children gain initiative through play, imagination, and exploration. During the school age years, they build confidence and competence by learning new skills and succeeding at school. In adolescence, teens work on forming their identity and understanding who they are. As young adults, people learn how to form close, meaningful relationships. In middle adulthood, the focus shifts to giving back to family and community. Later in life, people reflect on their experiences and gain wisdom. Understanding these stages helps parents support their child's emotional growth at every age. If you have any questions or concerns, we encourage you to write them down and share them with your healthcare team. No question is too small, and your providers are there to support you and your family. Reaching out early can help ensure your child gets the best possible care. Here is an overview of the ways you can contact our team. It's here for your reference anytime that you need support, guidance, or follow-up care. Thanks so much for watching.